We've got the second round of the hearing sessions of the London Health Commission. We're hoping to talk to a whole range of patients and clinicians about a number of areas which include what we can do to keep Londoners healthy and what we can do to better engage patients in the design of the care around them.
My key message would be that the Mayor needs to deal with the proliferation of fast food outlets that we've got, betting shops, and the way that alcohol is licensed and promoted, because these are key things that are affecting Londoners' health, and I believe more could be done in terms of planning.
To make exercise easier and to take the fast food joints out of public spaces.
We're polluted every single day with vehicles, especially diesel vehicles, coming in and out of London. You know, do something to stop all that pollution. We spend millions of pounds on older people going in and out of hospital, and children, 70% of which have either asthmatic tendencies or full-blown asthma. Do something about cleaning up the air in London, and do it fairly quickly, because we need to stop the pollution of air in London.
I think the one thing that would make young people healthier is that if we were actually teaching them something that they actually understood and that's related to their lives in our curriculum when we're teaching it to them, so in physical education or in science, if what we're actually delivering to them it actually made sense to them and actually related to health, rather than being very restricted, which is what the curriculum is at the moment.
I think it'd be great to see more young people taking part in sport at their local youth club.
I think the one thing that would make young people healthier is having good education and having good role models.
One thing that could make young people healthier is to know what they're eating. So not just about saying to eat right foods, and you can dictate that to someone and tell them eat this, eat that, but to make them aware about cooking and things that they're putting into their food, so that if they can see it and what it could do to their body and how it could help them and do it in a more positive way, teaching them how to cook from a younger age, so that when they're older they then make the time to cook and it's more fun for them, and cooking with healthier ingredients rather than things that would be bad for them.
All Londoners need to have quick, easy access to general practice. They need to be able to register with a GP of their choice in the area where they live. There's difficulty at the moment with people who are in temporary accommodation, renting, etc. If they can't prove where they live, they can't register with GPs.
One could see homeless people as casualties of a deeply unequal, unfair society. And the biggest thing which I think would change things would be to narrow the gap between rich and poor in our city, and that would lead to a fairer society for everyone, but also a society more willing to help the people at the bottom.
The biggest challenge that homeless people face is the multiple exclusions that they face throughout their whole lives in terms of accessing services and support. So policymakers and government can really do quite a lot to look at those barriers that are preventing people who are homeless accessing services and support, and actually smooth their journey through the system to enable them to get the support that they need to live the life that they want to live.
I think if the Mayor were to do one thing, helping people be healthier in London, it would be to help facilitate the relationship that the private sector, the public sector and the voluntary sector have together. Only by solving problems together will they actually make any long-term behavioural change and encourage Londoners to have healthier lives.
My key message would be really emphasising the partnerships between different organisations, whether it was public health, statutory organisations, voluntary organisations. There's so much expertise around, unbelievable amount of expertise, but to find great ways of bringing it all on the same table and working together.
One thing they can do is to manage their health better, but that's not going to happen until the structures and the systems of healthcare delivery are made more accessible.
I think I've learned today what an incredibly complex subject health in London is, and there's so many possible ways of tackling it. And obviously some of them are actually outside the remit of the Commission. But I do think probably the thing I've learnt that's most important is how really it's going to require an awful lot of people, a lot of stakeholders to work together to actually change things and improve the health of London.